I'm Todd Neal with MedPage Today. A study reported in JAMA found that an intervention designed to increase the self-management skills of patients with heart failure failed to improve clinical outcomes compared with education alone. Here to discuss the findings is Dr. Carla Dupree of the University of North Carolina at Chapel Hill, who was not involved in the study. Thanks for joining us, Doctor.
You're welcome. Glad to be here.
Now, how do the findings of this study fit in with those that have looked at similar strategies?
Well, I think this is a very carefully conducted study that looked at the effect of adding a self-management skill to an education component. But I'm actually not surprised by the results that they didn't see a difference. And I think there are several reasons for that. The first is that the education component was very robust. This included sending patients information in the mail several times over the course of the year, and then actually following that up with a phone call that made sure that they had read the information and that they had comprehended it. And I think this is an excellent educational strategy, but it's not usual care. So I think one of the concerns with this study is that they really didn't have a good control group. Another thing that was very evident, and I think all of us in the field realize that patients have trouble taking their medications. The non-adherence to medications in this study was very high. 35% of patients were not taking their medications correctly. And we know that medications such as ACE inhibitors and beta blockers save lives and reduce hospitalizations. And actually, over the course of this study, medication non-adherence increased by 7% in both groups. So the strategies that were utilized really didn't have any impact on medication adherence. Another thing that really brings people into the hospital very often is eating too much salt. And this causes weight gain, fluid retention, increased shortness of breath. And even at the end of the study, the patients in the intervention group, 72% of them were not following the prescribed low-salt diet. One other thing that I think that was very important that we learned from this study is that the prevalence of depression is very high. Major depression was reported in 29% of these patients. And we know from other studies that depression has a significant effect on outcome. So I think all of those factors contributed to not seeing a difference between the self-management strategy and the purely educational strategy, but I think it really highlights the things that we need to focus on in developing a new type of strategy, and those would of course be to really focus on a way to increase medication adherence and adherence to low-salt diet, and also to recognize depression and treat patients aggressively for this.
So is the lesson here that these self-management strategies aren't necessary and just sort of an enhanced educational strategy is necessary?
No, I don't think that's the message at all. I think that in this particular study, this particular self-management strategy was not effective. But if we look at the scope of this problem, 5.8 million Americans have heart failure. There are 23 million Americans worldwide with heart failure. 670,000 new cases are being diagnosed each year. There are over 1 million hospitalizations. It's extremely important that patients learn to work with their healthcare providers to improve their care. I think what this study has done is highlight those areas that we really need to focus on, and also think about tailoring the intervention to specific groups, such as I think there are going to be different strategies that are needed for certain groups. For instance, people with low health literacy are going to need a different intervention. People with lower socioeconomic status, we're going to need to make sure that they can pay for their medications. So I think this was an important study, and that we learned a lot from that, and I think this just becomes the basis for moving forward and developing new strategies.
Now, what types of strategies do you think will be more effective for, say, increasing medication adherence or decreasing sodium intake?
So I think it's very important that we ascertain how patients receive their medications, if they have enough money to receive their medications. For instance, the patients in my clinic take an average of 9 medications per day, and most of them are elderly. They're on fixed incomes. Even getting these medications at a store that only charges $4 or $5 a prescription can really add up. Having transportation to get their medications, those are the questions that I ask my patients routinely. How are you receiving them? How are you paying for them? How are you getting to the store? And really encouraging them to look for pharmacies that have delivery. There are also mail order assistances, and having somebody that can help them get their medications. And I think as far as the low salt aspect of things, that's a much trickier thing. Patients really, they're very used to using salt on their food, and you really need to give them alternatives. You need to teach them how to read food labels and actually give them a salt allowance. One of the things we're doing here at UNC is to compile a list of all the fast food restaurants and all the fast foods, because we know that even though we don't encourage utilization of fast foods, that a lot of people do eat fast foods, and it's just amazing how much salt content is in each of those foods. So I think educating patients, giving them alternatives to salt could really be helpful.
Yeah, well, Dr. Dupree, those are all my questions. I appreciate you taking the time for us today.
You're welcome. Glad to do it.
For MedPage Today, I'm Todd Neal.